everybody, and welcome back to another episode of Hybrid Healing Hour. Today, we are going to be talking about vitamin E. So I will go ahead and excuse myself if I mispronunciate certain words. This one is a little tough for me to say, but vitamin E is a fat-soluble vitamin, and it actually comes in several different forms. It's a group of 8 fat-soluble compounds that include 4 tocopherols and 4 tocotrienols. And Alpha-tocopherol is the natural form, and it's the only one that's actually used in the human body. So I'm really excited to be talking about all of this in a little more detail. But first, what we do on our episodes is we talk about history. So go ahead and fill us in on how vitamin E was discovered.
Absolutely. So vitamin E is something that we don't really talk much about. And most doctors don't talk about vitamin E, and most patients don't ask about vitamin E. Vitamin D has become very popular and is in the news, and there's tons of studies out there on vitamin D and the risks and benefits. But vitamin E is one of the essential fat-soluble vitamins as well, along with A, D, and K. So in 1922, Evans and Bishop discovered that rats fed a lard-based diet developed infertility. And so they suggested that there was probably a dietary deficiency involved. And the fertility was corrected when a lipid extract of cereals was added to the diet, and this was termed the anti-sterility factor.
And then in 1925, vitamin E was officially recognized as the 5th vitamin. A few years later, the name tocopherol, from Greek word of tok, which meant child, and pherol, which meant to bring forth, was coined to describe its role in the essential dietary substance in normal fetal and childhood development. In 1969, the U.S. Food and Drug Administration, the FDA, formally recognized vitamin E as an essential nutrient for humans. So with this being said, there's a lot of literature with the importance of this in development of children and babies and fertility. So go ahead and tell us some other benefits of vitamin E.
So vitamin E has antioxidant effects. It protects cell from oxidative damage by neutralizing harmful molecules called free radicals, which are thought to lead to cancer. So think of it as a free radical scavenger. It is oxidative stress.
So oxidative stress is a condition that occurs when there's an imbalance between your body's antioxidant defenses and the production of accumulation of compounds called reactive oxygen species. And this is what leads to cellular damage and increased disease risk.
When LDL is exposed to oxidative stress, it undergoes a cascade of changes affecting the vascular endothelium, thereby facilitating atherogenesis, which is where the plaque starts getting into the arteries, the walls of the blood vessels.
And supplementing with high doses of it can reduce markers of the oxidative stress and boost antioxidant defenses. And this can even be seen in some blood work. There's certain labs out there that can check for the oxidative LDL or oxidized LDL.
And unfortunately, trials of vitamin E supplementation have not generally shown effect in prevention of heart disease, but that's also because they use all the racemic forms of vitamin E, which we know that not all the racemic forms are beneficial.
Right. And we'll dive into that a little later too. So this has been shown that it can reduce the risk of heart disease, and it does that. So vitamin E with omega-3 supplements can lower the LDL and the triglyceride levels and help with people with metabolic syndrome.
Vitamin E supplements have been shown to reduce systolic blood pressure, which is the top number when you look at the blood pressure. I don't think they've been shown to do much for the diastolic, which is the bottom number.
Yeah. And with the risk of the heart disease, going back to that, I think we're like hounding in on this, but it's been shown to inhibit the platelet aggregation. And as you'll see, so that is what can lead to clots.
Right. And that's one of the reasons why you have to take some precautions when you're taking vitamin E if you're going to have a surgical procedure done. And we'll talk about that again. So vitamin E helps with cell proliferation, which it reduces the risk of cancer. In addition, it's needed for proper immune function and cellular signaling. Now, a New England Journal of Medicine article from 1993 showed some evidence that high intake of vitamin E was associated with a lower risk of coronary heart disease in men. And I know 1993 was a long time ago. And then there was another study done shortly after that that showed the same in women.
And vitamin E has antioxidant properties, as we already discussed, that can protect the skin from damage. So we know oxidation just in general is bad. I mean, that's when you look at a rusty nail, that nail has oxidized. I mean, our body oxidizes. Our body, therefore, that is aging, right? And so when you can reduce the oxidation of your skin, it helps with that youthful look and skin damage, right, from the sun. So it's actually is also a humectant and an emollient, which means it helps the skin absorb water and trap that inside. So it helps with the hydration of the skin.
And topical vitamin E can reduce UV-induced skin swelling, skin thickness, erythema, and edema.
So it's used a lot in the treatment of rashes. I know it can help with urticaria, which is hives.
And there's a lot of lotions and sunscreens that have vitamin E in them.
Right. It can also help balance hormones, particularly in women with PMS or fibrocystic breast disease.
It has been shown to slow the progression of cognitive decline. Now, that does not say it can reverse Alzheimer's disease or things like that, but I would say that slowing cognitive decline is an all-encompassing thing, and you want to add everything you can that facilitates that process, and vitamin E is just one of many.
Absolutely. There's also evidence that from some studies that suggest that alpha-tocopherol form of vitamin E, along with lutein and zeaxanthin, which is also a very big antioxidant, may decrease the risk of cataracts.
It can help with endurance and muscle growth. And it's necessary for the development of baby's development.
Great. So there's a laundry list of benefits of taking vitamin E. So let's talk about what are some symptoms of vitamin E deficiency. As you mentioned, obviously you can think of the contrary to some of the benefits. I mean, vision problems, particularly retina issues.
Peripheral neuropathy. We see a lot of patients who come in with neuropathy, especially what we call idiopathic peripheral neuropathy, where there's no obvious cause. And vitamin E has been found to maybe be beneficial in some of those people. And along with that, along with other neurological issues, you could have ataxia, which is the loss of motor coordination, or hyporeflexia, which is decrease of the reflexes.
And then there's immune dysfunction. And we know that vitamin E can actually shorten the lifespan of red blood cells, which could be a good thing, but it can also be a bad thing. It could lead to anemias. And I know it's been associated with hemolytic anemias in congenital forms, such as cystic fibrosis, not cystic fibrosis, sickle cell anemia is what I was going for. And vitamin E levels, they naturally decline with age, and vitamin E is also depleted by ultraviolet light. So hence, I think taking it and replenishing it helps with the skin and being out in the sun.
Right. So let's talk about some of the people who would need supplementation.
So anybody that has fat malabsorption are at risk for vitamin E because it is a fat-soluble vitamin. And so these deficiencies are because of the malabsorption of fat and fat-soluble vitamins. And in most cases, this is caused by pancreatic or liver, also known as hepatic or intestinal disorders.
Since we don't typically measure vitamin E levels, usually we don't, we can, but patients who have very low vitamin D levels and have some kind of absorption issue, chances are they also have decreased levels of vitamin E. For patients with cholestatic liver disease, in which there's insufficient bile in the intestinal lumen to help with fat absorption, and that's things like biliary atresia, primary sclerosing cholangitis, primary biliary cholangitis, and familial intrahepatic cholestasis. And these can also occur in cirrhosis.
And then there's patients with the pancreatic insufficiency, like, as I slipped up before, cystic fibrosis, pancreatic exocrine insufficiency, and if anybody had any part of their pancreas removed as a pancreatectomy, or chronic pancreatitis. And this is due to the lack of lipase to enable or help with the optimal fat absorption.
And people with extensive resection or disease affecting their small intestine, in which there's insufficient intestinal absorptive area to absorb the fat. So this includes people with short bowel syndrome, people with congenital intestinal lymphangiectasia, infiltrative diseases such as amyloid or lymphoma or Crohn's disease.
Right, which is actually pretty common. And there are also several, genetic disorders that can lead to vitamin E deficiency that we did not get into. But there are a couple caveats, as we mentioned before. When you are on vitamin E, it, as we discussed, can maybe have blood thinning properties. And so we do recommend that you hold this prior to surgery. And cancer patients on chemotherapy should avoid antioxidants. And we've discussed that on our glutathione podcast as well. And if you haven't tuned into that, go back and listen. But otherwise, let's talk about how we can get vitamin E, because it sounds like an amazing supplement that we should be on.
So like everything else, it's always best to get your vitamins through your food if you can. So vitamin E is found in a variety of foods, including almonds, vegetable oils, and cereals. The form that's best known for its role in human health is alpha-tocopherol, which is abundant in olive and sunflower oils and is the predominant form in the European diet. Gamma-tocopherol is another form which is abundant in soybean and corn oil and is common in the American diet. And it's vitamin E is typically found in wheat and green leafy vegetables. Peas are especially high in vitamin E.
And they actually, so if you're like me and you try to be gluten-free, there's some discrepancy on whether the wheat germ is actually bad for us or if it's just the way it's processed, right? And so they do have wheat germ oil, which is a very good source of vitamin E.
And there's certain foods that are very high in vitamin E, and these include, like we said before, sunflower seeds and oil, nuts, corn oil, spinach, broccoli, kiwi, and mango.
And I know they were saying that it's actually a rarity for us to be vitamin E deficient because most people get these in their diet.
And so we've discussed this before. There's a difference between deficiency and what optimal levels are, right? So we would like people to have optimal levels. And then with the fat-soluble vitamins, you need to be careful. You don't want to overdo it. So I would not recommend just taking huge amounts of any fat-soluble vitamins. But reasonable amounts would help supplement a diet, especially if you know your diet's not that great to begin with.
Exactly. And like we said, it's all going back to the gut and whether your gut is really working and absorbing all the nutrients that it needs to. But if you have malabsorption issues or are deficient, vitamin E supplementation for adults involve the more natural form, like we mentioned, alpha-tocopherol. And this is, once again, the only one that's used by the human body, but you can also get gamma-tocopherol. When you're looking at the label of your supplement, it's very, very important to make sure you get the alpha-tocopherol, or also known as D-alpha-tocopherol, or the gamma will just say gamma-tocopherol. These are straight forms of vitamin E. We don't recommend taking the synthetic form, which is known as D-alpha-tocopherol. So if it's got that L in there, do not get that.
And like all fat-soluble vitamins are best taken with the fattiest meal of the day. So things like vitamin D, vitamin E, vitamin A, omega-3 fish oil, CoQ10, all those that come in capsules that are filled with an oil, you should probably take them with dinner if dinner is the fattiest meal of your day. But in some cases, some people eat more fat for breakfast.
Now, the tocotrienols are typically in a mixed form. So it might say, mixed tocotrienols. And this is what has been shown to be very beneficial in lowering cholesterol and protecting the brain. This has also been shown to help with fatty liver disease and lowering the transaminase levels, like that's your AST, your ALT in your liver panel and in the blood work. But it's recommended to take them at least 2 hours apart. So maybe do your vitamin E tocopherol in the morning and then do your tocotrienols in the evening. And the dosing on these, we recommend about the upper limits of normal, or not normal, but the upper limits of the max dosing of tocopherols, I recommend is 400 international units. And for tocotrienols, we recommend about 300 to 400 milligrams. And those are typically found at any of your local pharmacies.
So population studies suggested that people who consume foods with more vitamin E or who chose on their own to consume a vitamin E dietary supplement had lower incidence of cardiovascular disease, cancer, dementia, and other diseases. And like everything else, it's all about diet. It's all about your gut, and it's all about your nutrients. And I think that vitamin E should probably have more role in our vitamin supplementation. And it's something, like I said before, we don't talk much about. The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.